Evening, everybody. Welcome to our July webinar. We are going to be discussing corrective feedback, and I will let John introduce himself here in just a minute. But quickly, I'm going to give you a quick overview of announcements for the center. Our next webinar is August 24th, which is also a Wednesday at 6 p.m. We have two EMS providers that are going to be presenting on burnout. So we're going to be bringing on Ryan Chatterton and Matt Rose. So that will be a really good webinar. I highly recommend attending. Tonight's webinar will provide you with EMS and IC credits. So keep that in mind if you're an IC. And we do have some upcoming EMS webinars we haven't announced yet for the rest of the year. I'm currently working on that. So keep your eyes peeled for those. I'm hoping to have the webinar scheduled finished through December, hopefully early next week. Also coming is going to be some early winter programming that I'm working on. It's going to be around potentially leadership and wellness, where we're going to be getting people together in person because we weren't able to do that until recently. So more to come there. There is going to be some more workshops coming through the center that are EMS centered and potentially leadership and wellness centered. So I'll keep you posted on that. And as soon as we have those things roll out through the office, we will communicate it through our list. If you are not on our list, please let me know. Or what you can do is go to our website and you can enroll in our newsletter so you can get all of our updates and emails. That's all I have for you tonight. This is a 1-hour webinar. It will be recorded and it will eventually go up on MyTrain. We are in the process of also building that infrastructure where we will be regularly now posting to MyTrain. So I'm really excited about that. All right, John, it's all yours. Thanks for presenting tonight.
Well, thank you. Thank you all for coming in here tonight. I appreciate it. And glad I have a couple minutes to talk to you guys. So a little bit about myself. My name is John Theut. I've just retired out of Ferndale Fire Department last year. I was the EMS coordinator. I worked there for 25 years. During that time, I was teaching at Baker College and an IC paramedic instructor. I did a lot of providing feedback to students in formal and informal ways. And now I'm working at the OCMCA as the QI coordinator. So I package up everything for the Professional Standards Review Organization so that they can review cases and also help them provide feedback to providers when situations do occur. But one of the places where I really learned about providing feedback was Toastmasters. I participated in Toastmasters. And for those that don't know what that is, it's a speech club, basically, for lack of a better term. And you get together and you do speeches. And one of the things that they teach you is how to evaluate people and how to provide corrective feedback in a positive manner. So for some reason, my slide's not going forward. I apologize. So that's who I am. And my slides are not going forward. I apologize. So today we're going to define corrective feedback, describe why it's important to provide feedback, and list 6 principles to providing feedback. So the first thing we got to talk about is the difference between evaluation and feedback. Evaluation is just that. It's the evaluation. And we fail a lot of times because that's where we stop, is at the evaluation. We take a look and we provide somebody with a test and we don't necessarily tell them the results. And I'm not talking a paper test. I'm not talking academically, because you get your score back, and I'm sure everybody's gotten their score back, looked at it and said, I got an A on that, or I got a D on that. I can't believe it. Or, wow, that's amazing. But what I'm talking about is, as we're watching people do stuff in our workplaces, and as we're training new EMTs and paramedics, we're watching them do stuff, and everything they're doing is an evaluation when they're new. And sometimes we are very bad at providing them with direction after we see something, providing them with the feedback. It's overlooked greatly, and it's overlooked because of communication.
It's 6:15.
It's overlooked because of communication. People don't always like to confront people, to give them bad news. We're going to talk a little bit about how to overcome that. So who gives feedback? Throw this out to me. Other than what it says right there where there's a comma and says everyone, and they did punctuate that one properly. Who gives you feedback? Oh, let's start with the first name I can see. Anita, tell me, who gives you feedback?
It doesn't show on any of that, but it is down in there where your
Stomach connects.
yeah, and they're gonna go in and
All right, sorry about that, Anita.
All
Somebody-
right, folks, if you are not on mute, be sure you are on mute when you come in. Sorry about that, John.
Oh, no problem. Go ahead, Anita. I saw you unmuted. Okay, Anita's having mute problems. Anthony, tell me, who evaluates you?
Your instructors.
Instructors, absolutely. Instructors evaluate you all the time. Who else?
Your partners,
Your
your shift
partner.
supervisor.
Yeah, so your partners, your peers,
Your
Yeah.
patients.
your patients, absolutely, your patients evaluate you. Sometimes they evaluate you all the way to the hospital, and you have to listen to it. So, and you got to understand, everybody gives you feedback. You know who else gives you feedback? I bet you that the person that you cut off in traffic the other day, I bet you they gave you some feedback too. Now, it might have been just a scowl. It might have been some sort of signaling with a hand, or maybe even two hands if they were able to take them off the steering wheel. So you got to understand that we are given feedback all the time. Not all of it's corrective. Some of it's just feedback. So we need to understand, and we need to be conscious and paying attention to everything that's going on. And where is it given? Basically everywhere. As humans, we need feedback in order to navigate through the world. We need to hear people saying things and have people doing things so that we understand we're moving in the right direction. And so it's given to us basically everywhere. And if you don't believe it, post a political meme on Facebook. You will get feedback from people you never thought had any idea of what you were thinking about. And so you just got to understand that feedback comes from everywhere. And again, it can be formal, it can be informal. So we just need to keep that in mind. Some of the differences between feedback are caused by the evaluation. So tell me, let's go to Charles Lanning. Charles, tell me what the difference between subjective and objective evaluation is first.
I'm not sure about that right now, but I get feedback from both of those.
Okay. All right. I understand completely. Well, subjective is opinion. It's very opinion based. So if I'm doing a subjective evaluation, it's completely 100% based on my opinion. Did that person, so we're talking about things in the affective domain when we talk about that. So was the patient care done adequately? Well, that can be a matter of opinion too. But if you look at, did they meet the protocol? Did they follow each step? Did they do what they were supposed to do per the standing orders? Did the patient survive? All of those things are objective. How was their bedside manner? Did they talk to the patient kindly? Those are all things that are subjective. So one of the things that we need to understand about subjective versus objective Objective evaluations are easy because they're tangible. You can sit back and you can say, yep, here's the rubric. They checked box A, they checked box B, they checked box C, they checked box D. So then when we provide feedback on that, we go, all right, listen, you checked box A, but you missed box B, but you checked C and D. It's very easy to figure out. When you got a subjective evaluation and you need to provide subjective feedback, it becomes a lot more difficult because then it becomes a matter of opinion. And when things become a matter of opinion, it's very easy for someone to shrug off the feedback and to say, well, that's just their opinion. So how do you take a subjective measure and make it an objective measure? Does anybody have any ideas?
I'd say by following protocol.
Following protocol, absolutely. If you follow protocol and there's subjective measures in there, you can absolutely make it objective. Is there another one?
Set a standard.
Set a standard, absolutely. You set a standard and say, this is what you're supposed to meet. And that can help you make an objective measure. But again, we're still looking at both of those are kind of check boxish. Is there another one you guys can think of? And I'll give you a hint. How about FTO programs? How do FTO programs take subjective evaluations of a new hire and turn them into an objective, tangible method of feedback?
Observations with codification.
Yes, absolutely. And so the whole thing is it's not just one observation though, right? It's multiple. So if you have multiple people providing a subjective evaluation and you have multiple subjective evaluations, that subjective evaluation begins to become objective. Does that make sense? So the whole idea is if you have one person's opinion, you got one person's opinion. If you have 100 people's opinion and they all are falling about the same direction, that becomes something tangible and a little bit more, it carries a little bit more weight when you're providing feedback. I guess a great example would be, so you got this probationary EMS employee that doesn't necessarily get along with others. And they're having arguments, but not really arguments. They're kind of the know-it-all person that, yeah, I know exactly what you're talking. Oh, yeah, you don't have to teach me that. I know. Well, if you have that with one person and one person comes to a boss and says, hey, listen, this person's doing this all day to me. Okay, the boss, depending on the boss, may go, okay, well, this is great. I'm going to act on it now. But what if it's just a personality conflict between those two people? So if you have 2 or 3 people that have said it, now you have something that's a little more actionable. And if you have 15 reports, so they get a daily report over 15 days, and it's all saying the same thing, then you can tangibly and objectively provide feedback to that person and say, listen, you are not working and playing well with others. We need to find a way to improve this. And that's the difference between subjective and objective, and how to make a subjective evaluation objective and thus provide feedback that's objective, because we never want to give opinion-based feedback. Opinion-based feedback is difficult, and your opinion might be different than another supervisor that's working the next day, or even your boss's opinion, or even all of their peers. So you want to use caution with that. So there's a couple different types of feedback. There's formal or informal. Where does corrective fall in there? Just looking for ideas. Where's corrective fall in there? Give me your opinion.
Well, it could be guidance at first.
Sure, sure. So that would be informal, right? You'd be just talking to them. Okay. Can it fall under formal?
Well, eventually, if they're not following the original direction given.
Yeah, I see Anita typed in the chat, formal. I see Bill typed in both, and that's great. Absolutely. It's document the incident is formal. Absolutely. So your types of feedback when it comes to corrective can fall into both. And a good way to think about it is the police officer that's sitting on the side of the road when you drive by speeding, turns out, flips on his lights, and then as soon as you slow down to the speed limit, shuts off his lights and pulls off to the side again. That was informal and very nice of him. However, the one that follows through, pulls you over and hands you a ticket, you still got corrective feedback. It still worked. So that's the direction. And what are the goals? So in the end, when we're doing corrective feedback, what is the end goal for corrective feedback?
Change behavior.
Change behavior. That's it. And we're going to change behavior by educating, informing, and improving performance. So educate. Maybe they didn't know. The one thing that I discovered in a lot of years is there's a lot of assumptions made that people know things they don't really know. And they sit back and they go, okay, we're working on something. A great example was the other last year, before I left the fire department, I was teaching a group of guys CPR. And I was teaching them how to do back blows and chest thrusts on an infant. And one of the younger medics looked at me and he started messing around with the baby, which is what I thought. He wasn't holding the baby right. And I said, come on, man, listen, we got to get through this. This is serious. You need to know what to do in the future if something like this happens. Quit messing around and let's get through this. And he looked at me and goes, I never really had anybody ever teach me how to do this the right way. And I said, so you never learned how to do infant back blows and chest thrusts for a choking infant in EMT or paramedic? He said, no, it wasn't part of the examination to get his BLS card, he said. And I said, okay, so we had to educate him that and provide him that corrective feedback. Sometimes people don't know they have a problem. You ever have the smelly kid? You ever have somebody that just, they forget to take a shower before they come to work, and they do it quite a bit and they can't really smell themselves, but you've had 5 or 6 people come up to you and say, we'd really need so-and-so to take a shower. That'd be really helpful. And you go and let that person know. It's awkward, but they might not have known. They might have had no idea that they were giving off odoriferous emanations. They might have no clue. So we inform them, and hopefully that fixes the problem. And again, that can be formally or informally. And sometimes maybe they just need a boost. Maybe next week's lecture or next month's course is talking about burnout. Maybe they're just burnt out. Maybe they need to have a conversation. Maybe there needs to be a heart to heart. Maybe you need to point out, what if that patient was your mom? Would you want that patient to be treated a little bit better? Absolutely. And so we want to make sure that we're providing this information so that in the end, we change the behavior, because ultimately that's what we're looking for. And that's what we're looking for at PSRO, at the medical control end. When the PSRO is looking at an incident and there's obviously a medication error or something to that effect, the goal is still those three things leading to the fourth, changing of behavior. We want to just make sure that we educate and help so that the behavior is changed and patient care gets better. So some of the guiding principles about giving feedback, and these are just things that I've learned over my career. These are things that I've learned in Toastmasters. The first one is be respectful. If you're using, don't call people names. And I think that's probably the best way to do it. Don't yell, don't scream, don't use adverbs. And a lot of people get around calling people names, because I know everybody's sitting there going, well, I would never call somebody a name. I would never look at them and go, you were dumb. That doesn't happen anymore in modern workplaces. However, we do say things once in a while like, you behaved poorly, or your actions were done stupidly. And so by adding in adverbs, and there's a whole bunch of other ones that you can add in there, you're still sending that message. And what you're going to do when you do that is put up the shield. If you approach the person and say, listen, I'm not sure what happened here, but let's talk about this, because this didn't appear to go the way it should have gone. So let's go down a road and be respectful. One of the other ones, and this is one of my favorites, is follow established norms, not pet peeves. So you have a policy at your work that says between,
real quick, I need my purse for my headphones.
you have a policy at your work that says you're supposed to be have a tucked in shirt from the hours of 8 to 5, but after 5 you can be untucked. That's your policy. And at 20 minutes after 5, you walk into the kitchen and you see somebody with their shirt untucked as you're going home from your shift, and you pull them aside and you say, listen, I think it's unprofessional that shirts are untucked. You need to tuck in your shirt. You've lost. And you've not only lost because there's already an established norm in as far as a policy, but you've lost because in the future, that person is not really going to listen to what you have to say, because they're going to think you're going down the pet peeve road again, and they're going to discount what you have to say. And obviously that does nobody any good. Be descriptive, not judgmental. And what I'm talking about is normative when I say judgmental. So descriptive is how the world is, and judgmental or normative is how the world should be. So you need to, a great example of that is paramedics, when they get hired, should be able to take their license that they've received from the state of Michigan, and they should be able to immediately get on the road with just, learning, one, where to park the ambulance, and 2, where the hospitals are. Other than that, they should be plug and play, and they should be ready to go. That's things that I have heard from EMS administrators over the years. That is, how the world should be. It's really not necessarily how the world is, because how the world is you have this brand new paramedic that has only seen patients with the safety net of having their at their clinicals with other paramedics there, and you don't really know how much interaction they had with the patient and how much patient care control they actually had. So we don't really know where this person is. And so where the world actually is whenever we hire a new paramedic, we need to see what they're doing for a couple minutes before we throw them out on the road. And whatever that is, whatever you follow, whatever your orientation procedure is. But the point is there's a lot of people that believe they show up, they should be able to go. But again, that's how the world should be, not necessarily how the world is. Next one is be specific, not general. So listen, I want to talk to you about that CPR. It was awful. So not only was I not being respectful, but I'm being very general. Well, what part of the CPR was awful? Well, when you did your chest compressions, you didn't have them really in the center of the chest. You were more up towards the neck. Now I'm getting into the specificity. So then was the rest of the code, was the rest of the CPR okay? Yes, no, maybe. But you need to be specific so that person is able to fix where the problem exactly is. You need to dive down and find exactly where the problem started. You need to do root cause analysis of what the problem is. You know, if you have people that are working tons and tons and tons and tons of overtime and they make a medication error at 3 o'clock in the morning and they're working on the backside of a 72 hour shift, well, maybe it wasn't the fact that they need more medication math, maybe they need more sleep. And those are the things that you have to look at. You got to be specific in what you're looking at. You got to do some root cause analysis. Focus on the performance, not the personality. How many of you have ever had somebody come into your office that you want to talk to them about a run and they are instantly within seconds on the defensive? Or have you seen peers that has happened where you've gone and talked to peers about how a situation is and they're instantly on the defensive? You need to focus on what occurred, not their reaction right now. Now, their reaction right now, depending on how it is, could lead to some other performance evaluations, but that's not what you're there for at that moment. And so focus on what the problem is and not their personality. And the other issue you got there is sometimes you have people that don't necessarily have a great personality to begin with, and you have a personality clash between them. Again, focus on the performance, stay away from the pet peeves, and be respectful. And Anita typed in the chat here, we always have done it this way. Yes, absolutely. 200 years of service at the fire service, 200 years of service unencumbered by change. Exactly. We've always done it that way. And there's no room to grow. And I challenged a couple of my guys and I said, yeah, we've always done it that way, but it seems like we don't have to feed the horses near as much as we did before, back in the old days. So yeah, absolutely. We always have done it that way is one of those. Don't fall into the trap of engaging on that. Stick to what the performance issue is. So the beatings will continue until morale improves. Absolutely, Gerald. And that is another thing that they like to say. Share information, not advice. This kind of goes back to a little bit about your opinion. Sometimes your opinion can get you into trouble because once you move away from the established norms, then you start moving out on to that limb. And so you share the information about the incident, and then you look at the probationary EMS worker and you say, hey, listen, let me give you some advice. I have had no less than just about every time I've said, let me give you some advice, that I have then been in my supervisor's office hearing about how I was giving somebody advice and not necessarily solving a problem. And because people take that wrong. They're already on the defensive because they're trying to defend themselves. And then you say, well, let me give you some advice. And if your advice is, listen, especially when it's an effective thing, listen, next time they argue with you about that, just don't say anything. Well, then your boss finds out, well, hey, listen, comes to you, I'm going to give you a piece of advice. Don't tell people not to say anything in the future. And it's just, it ends up going down some slippery slopes. The next one is make the feedback well-timed. And this is where professional standard review organizations, the medical control PSROs, this is where organizations that do their CQI much later fail. And it's because it could be 6 months or even a year before the case ends up making it to a PSRO or some sort of large agency review board. How many patients has that person seen between then and the incident that they've just done the same thing? Whereas if you're an on-scene supervisor and you see something, if you can say something quietly right then, hey, are you sure you're doing the math right on that? Let's recalculate that. And then you do the math and find out they're just a little bit off. Or maybe we should take this chest pain patient to the hospital, or maybe we should call medical control and ask them about this sign off. As opposed to 6 months later, having a PSRO look at it and go, why didn't you guys just call medical control and ask a couple of questions? So well-timed feedback is important. The other thing is, and I've learned this through training students, I've learned that if I told them or gave the impression what they did was right one time, it took me at least 20 times to teach it out of them if they were wrong. So if I didn't correct them initially, right at the start, they're in a learning mode. And same thing with probationary EMS employees, they're in a learning mode, and it's going to be hard to teach it out of them. And just for an example, think about back to everybody's your first American Heart Association ACLS class that taught you guys how to do the algorithms for taking care of a cardiac arrest. I can still tell you mama shock, papa shock, little shock, big shock. I still can go through that whole thing, top to bottom. Nobody ever told me at the time that that was ever going to change. Timely advice at that time when I said, listen, learn this, but understand that this could change in the future. I can guarantee all of you are thinking back to your first ACLS class and can probably recite what the first algorithm was because you wanted to learn it and you needed to learn it. The next, and probably one of the most important things when you're dealing with corrective feedback that has moved, and even if it hasn't moved past the informal, but really just about every time you need to make it private. Providing feedback to somebody that they made a mistake in front of their peers is difficult and embarrassing for them. And we want to make sure that when that happens, when they're getting that feedback, that there is no extra guards that are going to go up. There is no extra blockers. We also need to make sure that the cheering section that may like them more than they like the person giving the feedback does not take their side and embolden them and more cement where they're at. So understand that these are just some guiding principles that I have. Does anybody have any other guiding principles they'd like to share over their tenure as providing feedback? All right, moving on. So the biggest thing I can tell you about providing feedback is practice. And the before picture shows what it's like. It's hard. It's hard providing corrective feedback. I will tell you, providing good feedback is easy. You pull everybody in a room and you pull the person up to the front of the room that did a good job, and you tell everybody how great they were. Everybody starts clapping their hands, and nobody's embarrassed. Everybody feels good. But when you pull somebody into a room and you need to tell them, hey, some of the crew members have been telling me that you might need some deodorant. That's hard. And the only way you get better at providing feedback is by giving it. I'd like to tell you there's some magical way that it gets easy, but it just doesn't. Providing feedback, especially corrective feedback, is hard because it's hard for the person to hear. And what have we been told? What have we been told all of our lives? We've been told, be nice. If you don't have something nice to say, don't say it at all. So it's one of those things that kind of is counterintuitive to us to walk up to somebody and say, hey, listen, I don't really think that you're doing this the right way. Sometimes it's our own personal confidence. If we aren't confident in our skills, and that person challenges us, is that going to cause us any problems? And I will tell you that most people, when they're getting ready to provide corrective feedback, I strongly encourage you to go take a look at the policies that you're going to correct on, the protocols. Take a look at a textbook if you're talking about patient treatment, and make sure you're going down the right road to provide that feedback. If it's on-scene feedback and you know it's correct, provide that feedback. Absolutely. Make sure that you guys are going in the right direction. It also makes it easier. And after a while, it gets easier. Some of the other things is a lot of you attend meetings. I see several names on this call that I've attended meetings with. And if you're at the meeting, talk. You're at the meeting for a reason. Those are good opportunities to, first of all, build up your confidence in speaking in front of people and your confidence in, maybe protocols or whatever the case may be. But two, it just gives you that practice so that difficult conversations are easy to have later on. And I'm going to put it right where it's at right now. We are in an age where discussing stuff with people and having a differing opinion can be kind of concerning because we're not sure how people are going to react. And you just need to make sure you give it and you're polite and you follow those tenets that I was talking about. Those are great tenets even when you're sitting in a meeting. So, Anita, you had put this in the text. Absolutely. Sandwich the criticism between compliments. I learned this in Toastmasters, and it was very, very helpful. You start off reviewing the good, and then you review the bad and how you're going to fix it. And then you reinforce the good. So, an example, not actually one that I would use, but an example. Hey, listen, you had your uniform. It was perfect, pristine, nicely pressed. It looked really, really good when you went out the door on the run. You got out the door. However, next time, could you wait for the door to be completely up before you drive through it? But you know what? You looked good doing it. You looked really good driving through that door. So again, I don't know if that's exactly how I would approach that, somebody driving through an ambulance bay door, but that is a way. You tell them what they did good. They got in there, they started the vehicle up. They made sure everything was right up until the point they hit that door, everything was good, you know, so that is the feedback sandwich. And in Toastmasters, that was one of the keys, because somebody would give a speech and then we would have to find the good in the speech, even if it was awful. We had to find the good in the speech, then tell them about how to fix the bad, and then again, reinforce the good. It brings down the defenses a little bit, and it helps people learn, and it puts them on a nice even ground. Some of the other things that you can do that have been shared in past classes, find common ground with the person. Find some common ground. Go over an incident with them and ask them, what do you think went well? Yeah, I think these things went well. What do you think went bad? Yeah, I agree. I think these things went bad too. Hey, one more thing I'd like you to take a look at is this little thing over here. Maybe we can improve on that going forward too. And that helps. Blunt honesty is, for some people, very, very good. For some people, it can be too harsh. You got to know your audience and you got to know the person you're talking to. And frame as an opportunity to improve. So if you can frame any conversation as an opportunity to get better, then you're great. But you got to remember, your track record will follow you. So if the only tool you have in your toolbox is a hammer, everybody starts looking like a nail, and everybody that you start talking to feels like a nail. So if you have other tools in your toolbox to get people to do the right thing, your track record will then follow you. So if you're able to talk to them and explain the big picture and educate them, as opposed to providing them days off, taking away pay, things like that, then those are ways that you're able to develop a track record and get them to trust you, so that a lot of these forms of feedback are more effective. Does anybody have any other suggestions, any other techniques for providing feedback that for the group that would be good to hear?
Well, I was told to give compliments in public and give criticisms in private.
Absolutely. Absolutely. And if your track record always follows that, your group, the people that are being, that you're providing the feedback to, will pick up on that, and they'll trust you when you pull them in and say, hey, we got to have a talk. Anybody else?
I don't have one. I just want to comment. I said, I find it odd that every time that you do feedback with someone, you do it, you do it private, you try and do it correctly. And as soon as you're done, they run out and they have that discussion with everybody in the workplace.
Yeah, the court of public opinion is great, isn't it?
Love it.
And that's so hard as a supervisor, because we don't have the right to go out there and give our side of the story. So then they end up, all the crews get their side of the story. It does make it difficult. And sometimes when that happens, you need to pull the person back in and go, listen, I don't have a problem with you telling all the guys about it, but could you tell them the whole thing that happened and not just this little, this one section? So, and Trish put in there, each person is an individual, so each person may be treated on an individual basis. Absolutely, Trish. Knowing who you're giving the feedback to and how they are going to react is huge, especially if you're a supervisor. Knowing as a supervisor which crew members can take being blunt and which crew members that you have to kind of walk down a primrose path to make them see their mistake is huge. And it's really important that supervisors and peers know the people they're working with, so they know how to do it. And unfortunately, EMS has a bad habit of getting to know their peers well enough to understand which buttons to push to get them to explode. And that's something that we need to avoid in this process. So So the reaction, and we kind of got a little bit into talking about it. These are how you can, the reactions you should expect. Acceptance, questions, excuses, anger. You might even get some irrational stuff like, why is this happening to me? If you start getting some of those irrational things, you need to start going and looking down the road of, is this person mentally going down the right track, and does this person need help? Is this, whatever this behavior is this a cry for help? And then you got to look at the mental health first aid part of it. And one of the biggest things that I would say, as people start giving their answer back, a lot of people call it an excuse. Just remember, an explanation can be considered an excuse if you don't want to hear it. And I've had many times where I've pulled somebody in the office. I said, hey, we really need to talk about this. Explain to me what happened here. And, because this doesn't look good. And then they provide me with an explanation that makes perfect sense to how the situation occurred. So we got to understand, we can't come in hot. We can't always just assume that they're going to give us an excuse. Sometimes they're going to say, hey, I did it. I apologize, but here's why I did it. Sometimes they're going to look and go, are you sure? Are you sure that's what happened? So we just need to make sure we go down the right road and give them the opportunity to provide their rationale and reason. We understand that looks like an excuse, but if they start off with, listen, the sun was in my eyes, that's why I defibrillated the wrong guy. Okay, then that's probably an excuse and we need to go a little bit different direction. So feedback results. And again, we talked a little bit about this before, and this is a quote from Vescuso. He was a fire captain in New York. If they don't know, teach them. Because if they don't know, that is what we have to do. We need to teach them. And that way we correct the feedback. If they can't, help them learn how. Because teaching them how to do what it is they can't do, that could be something. Maybe they never learned how to start an external jugular. And so that's why they were fumbling around on scene trying to figure out how to do it, because nobody ever taught them how to do an external jugular. And if they don't understand why, share the importance. And again, if they don't know, correct them. And Patricia asked a question, how should we handle when they are not being honest with us? Well, Patricia, that's where it gets a little bit difficult. And again, that's where excuses start to come in. And if you're getting the feeling that they're not being honest with you, unfortunately, what you're going to have to do is you're probably going to have to expand it out, because now we're talking a behavior. Another behavior you got to fix is the honesty part. But first you have to identify if you have a problem. And so you're going to need to pull in other crew members and develop a pattern of behavior that this person isn't honest. And it's very difficult, and we hope people are honest, but when people aren't honest, we hope to catch them in what they're not being honest about. Does that make sense? It's hard. I'm not, there's no silver bullet for that one. It's just, you got to ask a lot of people.
Yeah,
Yeah,
thank you.
Yeah, John.
Yeah.
I just had a thought on that. I've been in the situation talking about honesty, and if you're maybe the new person on the block and you've been trained by 5, 6, 7 different people on how to do it 7 or 8 different ways, that can be kind of, confusing. And I found in the past that when someone comes to, maybe correct me, and, I'm thinking, wow, I think I heard it from the boss this way. And if it's something where I think sometimes that can really be on your record, if there's something that, you just don't want to be complained about to the boss or the manager or the chief. And so I've actually started approaching that just a couple of times I've had to just say to that person, I understand what you're saying, but I'm confused because I learned it this way. So, I'd really like to talk with you, with the chief, and let's see if we can figure it out together. So when you have a chance, we can all meet. Let me know. I'm totally open. As soon as we can, I'd like to do that. And it depends on how important it was to that person if I ever hear from them again.
Right. No, I agree with you 100% because you hit the nail on the head. I had a probationary employee come to me, and we were talking about how he started an IV. I can't remember exactly what, but I'm just going to say that for now. And he told me, he goes, I've had 5 different partners in the last 3 weeks. He goes, I've learned 7 different ways to start an IV. He said, I don't know which way is right. Can we learn? And that's where, if they can't help them learn. And like you said, hey, why don't we all get together and talk about this so we can fix it? Yeah, if they show up and want to do it, that's golden, because now they're invested in fixing the problem, and the problem will eventually solve itself. No, that's a great way to do it. And then Bob Cesario put in here, if they're not being honest, then make the training mandatory. And if they know it, no worries. If not, it'll reveal itself later. Yeah, it will. Absolutely. Absolutely. Great comments. So avoiding future problems, document the feedback. And this is some other place where we make a mistake. We don't document our feedback. And I know this kind of goes against some lines of thinking, but even if you give corrective feedback that is informal, you should at least make a note of it someplace so that you can see if this is happening again. And allow the student or employee to see what you wrote. Allow them to respond to it. Share with them and review later to gauge their success. And one of the other big things about this is if this person is also supervised by other people, and now I'm talking about supervisory reports. If this person is supervised by somebody else, so say I'm on, I work afternoon shift, and this person works afternoon shift this day, but a 24-hour shift the next day, and he's going to go through 3 different shift supervisors. I'm going to let those shift supervisors know that I had a talk with them about this. I'm going to be very upfront and honest and say, hey, listen, it wasn't a big deal, but I mentioned this to him. And the reason is because if I saw it, he got away with it with a, hey man, fix it like this. Then if the next person saw it, said, you know what, this is the first time he's done it. Hey, you need to fix it. And then the next one, and then the next one. All of a sudden, this guy has gone through 4, maybe 5 chances with 5 different supervisors. And all of them been nice the first time, saying, hey, you need to fix this. When actually this person has now broken the rule 5 times and is in need of an adjustment. So just something to think about. And ask others to provide feedback to you. This is something that I've done my entire career. Supervisors, peers, students, subordinates. I'm very big on making sure that I'm paying attention to what I'm doing, because we don't grow if we don't know. And we need to grow as supervisors, instructors, people that provide feedback on a regular basis. And I'll tell you, one of the most important ones that I've used is the students and subordinates. I've sat down in a paramedic class after the first couple of weeks, and I've pulled up a chair in a group of them at a lunch table and said, listen, how am I doing? Am I meeting your needs? Am I giving you what you need? And they provide me feedback. Now, sometimes it's guarded feedback because they don't know how to take it, because people don't ask for that information. But after a while, they get used to it. And you know what? They're pretty honest with you and say, you know what? The way you're teaching this doesn't really work for me. If you could look at it this way. Or subordinates, listen, the way we're doing this drill didn't really help. You know, can we do it a different way? I still don't really understand it. So just some things to think about to make sure that we're getting our own corrective feedback and we're seeking it out. Seeking out our own feedback is very important. Are there any questions? Any
I have a
comments?
question.
Yeah.
So what do you do with the employee that is stuck in victim mode?
Oh, victim mode. Yes. Everybody's coming after me. Everybody's trying to, unfortunately, that's an effective domain issue. And it's also, and it could be a myriad of things. It could be their confidence. It could be just how they brought up. What I've done in the past with those is said, listen, I understand. I get it. You feel like they're after you, but I'm telling you, nobody's really after you. Everybody here has told me they like you. You know, if they've honestly told me they actually like them. So what I do then is, I did have an employee like that. I gave him a pep talk, and then I went and talked to the other employees and said, hey, how do you feel about this person? Oh, she's good. We like her. She's okay. We don't have a problem with her. We just don't know her. And then I was able to pull that person aside and say, hey, listen, there really isn't anybody here that doesn't like you. So I don't think anybody's coming after you, but I'll keep that in mind in looking at your evaluations going forward. And let's see if we can work through this. And I've had some success that way.
Interesting. Okay, thanks, John. The evaluation link, it was just dropped in the chat, by the way. All right, I'm gonna stop recording for us tonight. And then we